The talk I gave yesterday was really looking at practical applications of digital health in clinical settings. So what I was trying to do was show that it is possible to scale up digital solutions to a reasonable size, but there's a large amount of barriers in our existing system because it's inert that stops us from really delivering or obtaining the maximum impact for the use of the technology. From my position as a clinician, the key ones are having access to electronic health record to start with, particularly for elderly patients, because we don't know what's normal until we find out what their past history was. The project I was doing was actually aimed at children, and for that it was the ability to access x-rays, the ability to access blood tests directly at a distance, but principally it was the fact that we were able to actually see the patient directly. The reason for that being that people worry about children a lot, but often when they describe it over the telephone, they will always tend to overestimate that the child's unwell, and that's led to large attendance rates in emergency departments across the UK. However, with eyeballing them combined with the other factors allows us to reassure parents and reduce the unnecessary workload on secondary care services. Modernising delivery healthcare using digital healthcare really has two aspects to it. The Welsh Government were actually the first one in the UK to put in a infrastructure for allowing video conferencing way back at the end of the last century. So that if you build a platform, and we've done this now in Scotland as well, where you can actually use telemedicine from a technical point of view, that's essential, there's no doubt, and that's where they have put their money in the past, and that's it. The next bit is the adoption, because you need to have train tracks to run the train. The next thing is you need to build what you're going to put on there, or roads, and you need to encourage people to use it. So yeah, number one is always infrastructure, so you can actually perform this. The next thing is finding drivers for clinicians to change their practice. Now, the thing in the NHS is that may not be money driven, because we're not a particularly money driven healthcare system compared to other places in the world. So you need to find other incentives, and that can be standards or guidelines or whatever, but we have to find a way whereby this improves the experience, not just of the patient. The patient is of prime importance, but we have to make it that it is easier or as a benefit for the healthcare providers to change their practice to utilise the technology. Driving change in the NHS is incredibly difficult, and I actually think there is some of it coming from within, but the problem is the pilots that are successful have no route up to become big projects. I think a lot of the drive will come from two sources. First of all is industry, because we've got all this equipment, all these networks, they want us to use them, we should be using it. The ultimate, I hope, driver will be the patients themselves, because I think we have a culture in this country of dependency on the NHS. I think we have to move from that to say, no, this is a consumer culture, and this applies to individuals and organisations, to say what's in the marketplace, what could we do that isn't about what treatment I get you, but how do we deliver care so you will get care when you need it, as close to home as possible and of the highest standard, and it hasn't to be linked to a physical area. So if we do that, we could absolutely transform how things work.